when looking at the ASCENT-03 data with SG, what should we expect in terms of adverse event when giving sacituzumab govitecan?
Yeah, I think many of us have experience giving the drug already. I'm sure many of the community oncologists watching this will have some familiarity. And so thinking about neutropenia, leukopenia, and dose holds and reductions for that. In the ASCENT-03 trial, I do not believe they were mandated to use G-CSF on, day 9 after the, day 1, day 8 of the treatment, which many of us now that the label's been altered do that. Diarrhea was another adverse event that showed up as there was a good percentage of patients grade 1, 2, and then even some grade 3. So I think those are the main things you think about when you're thinking about SG. That might differentiate it. And I think thinking about different toxicity profiles is an important part of the discussion with our patients.
I think one of the big things also about this first line is also the alopecia associated with SG. That's another thing that is almost guaranteed patient will get it, which a lot of patients want to see if there are options that can preclude them from that. But you're right, a lot of the side effects I feel with SG are similar to those we see with chemotherapy.
Yeah.
Right. Now, how about with the Dato-DXd on the tropion breast? What side effects should we expect from that drug?
Yeah, so Dato-DXd is different from SG in terms of its side effect profile. So really distinct set of side effect profiles between these two agents. I'll address alopecia first since you brought it up, and that's a very meaningful endpoint for these patients in the frontline setting. So, with the DXd ADCs, we've seen alopecia in the range of 30 to 40% on trials, and that's pretty consistent, and in TROPION-Breast02 as well. So that's what we expect. Otherwise, there were high rates of stomatitis, some of that mitigated by the prophylactic use of steroid mouthwash for patients, and then a high rate of keratitis as well. And then that can be bothersome for patients to have, dry eyes and itchy eyes. And so again, we can prophylax to some extent with lubricating eye drops. So really important to think about prophylactic strategies for these patients before we start. Otherwise, there was a little bit of nausea. We don't see a very high rate of ILD with Dato-DXd as we do with TDXd, so that's important. It was very, very rare events with ILD.
So something very important for our audience is that contact lenses, right?
Yes.
Do not use contact lenses with Dato-DXd.
Yeah.
On the studies, these are, because mainly it's dry eyes, like you mentioned.
Yeah.
The patient who had, abrasion and stuff like this to their cornea, these are the patients who were doing contact lenses. And that's how we learned that no contact lenses with those drugs. That's very important. And that's important to talk to your patient about it earlier. I don't know who's wearing a contact lenses or who wear glasses in my practice. Like you cannot tell. And there are those patients, when you mention the contact lenses to them, they'll be like, no, I'm not going to go back to glasses. I had a patient in clinic 2 weeks ago. So she wasn't triple negative. She was hormone positive. And we were talking about Dato. And I told her, like, I don't know if you wear contact lenses, but please, no contact lenses if you go on the drug. She was like, absolutely not. I'm not going back to wearing glasses.
Yeah.
That was big for her. And that's shared decision making. Yeah. So we need to talk to those because we tend to forget it sometimes, but it's very important. That's when trouble tend to happen. But you mentioned two very interesting things. Like whenever you look at antibody-drug conjugates, side effects can come from multiple different places, right? It can come from the target, so that's where the antibody goes to, or it can come from the payload itself. So, with Dato-DXd, the Deruxtecan, or the Govitecan with HG, you definitely see more of the target side effect with Dato-DXd. So we know that TROP2 is highly expressed on mucosal surfaces. So mucositis, you do see it on the eye, so you see it highly expressed. Now, on the other end, you see a lot of the chemotherapy side effects with SG. Something here tells me it has to do with the biology of that linker.